What I'd like to do today is demonstrate lower extremity manipulation with two various techniques, both diversified and activator technique. The joints I'm going to address are the hip, the knee, the ankle, and the feet. What I'm going to ask Ron to do first is lay face down.
See you tomorrow.
Understanding the lower extremities, there's a variety of conditions that come to our office. Obviously, all these have to be properly evaluated and diagnosed prior to treatment. In this case, we're going to show you some hip conditions that are very common. Many a times occur with tightness in the muscles and the joints due to altered biomechanics over a period of time. We're also going to address the knee, the ankle, and the feet. First thing I always do, once I understand the condition, whether it be a hip or knee, is I always palpate into this area called the popliteal muscle. And I look for tenderness into this area. Once again, when there's a hip problem, more than likely it will relate to a knee going down and vice versa. If there's an ankle problem, many a time it will relate to a knee and hip and the spine, as the foundation will affect the rest of the body. So you cannot isolate just to one area. You have to evaluate and check every area. In studying the hip motion, the first thing I'll do is I'll bend the knee and I'll rotate both externally and internally, feeling the motion and pliability of both the soft tissue and the joint capsule in this area. Now I feel a little bit of restriction in here. In this case, I'm going to use a Thompson drop table. Take a deep breath and blow it out onto that area. If I make a correction on one side, I'm always going to examine the other side in order to have proper balance. Both your hips are restricted. I'm just adjusting the attention in order to have a little bit of resistance on the table. Everything comfortable?
Yes.
I'm going to ask you to lay face up. Now I'm going to evaluate both the knees. And the first thing I always do is I palpate the patella, the kneecap, and I want to see how the kneecap tracks up and down the femur. I always compare one side to the other. Got a little restriction on your left. So there's a little restriction on the tracking of the patella on the left leg as it tracks up and down the femur. So I'm going to work on this a little bit just to kind of restore that tracking motion, which allows us to perform, whether we're running, jogging, a lot of different sports and athletics. Once again, I'm going to go back to the hip and just check the hip motion. All right. Your knee just released.
Yep.
Okay. And we can see there's a little restriction on this side of his hip. So I'm actually going to go into this with the drop table technique. Okay. And this could also be made a correction if the patient's more sensitive with an activator technique. I'm going to come back to that knee and check its track. A lot better.
Yes.
A lot better. Now what I'm going to do is flex the leg up and down. I'm going to feel the fibula, the motion of the fibula on the tibia, and also the alignment of the tibia on the femur, which is a little bit torqued. Okay? Once again, permitting the patient to be able to perform. And this is where chiropractic is utilized on a proactive performance level and not just reactive to pain or discomfort. Take your shoes off. When working with the feet and the ankle, the first thing I always check is flexion, plantar flexion, and extension. And he's limited on extension, your plantar flexion. So what I'm going to do is adjust right there on the navicular of the foot. Nice. And that was a diversified technique applied. And then on the digits, we first want to check to test its motion. And we can see his feet are going into extension. So we're first going to stretch these digits. As I stretch them, they'll release. And then we're going to adjust. Now, once again, patients with conditions in the feet many times affects their ankles, knees, and hip. But also, on a proactive level, many of our runners, joggers, will check these lower digits to make sure they're at their optimum level of performance. Chiropractic is a healing tool, but also a performance tool to enhance one's abilities in their sport. Thank you.